In this video, we'll present a case of a patient who had an ultra-rapid formation of distal anterocerebral myocardial aneurysm. The patient was a 29-year-old gentleman who had active endocarditis, had a CT angiography, was found to have a middle cerebral aneurysm. At the time, the patient was neurologically intact. Cerebral angiography demonstrated low flow on the aneurysm, and the decision was to treat it medically only. Then the patient underwent cardiac surgery and woke up fine from surgery. 24 hours later, he became unresponsive, complaining of headaches and hemiplegia. This is the initial diagnosis of cerebral angiogram. You can see a small MCA aneurysm, and then he was treated medically. And this is the CT progression. Each CT scan, it's 1 hour apart. You can see the progression of the interventricular hemorrhage, and EVD was placed, and despite that there was a third hemorrhage. At the point, the patient was taken immediately to surgery for a right craniotomy and evacuation of the hematoma. During surgery, we also removed the first right MCA aneurysm. However, we did not see the hemorrhage related to that aneurysm. After surgery, we decided to do a CT angiogram that revealed a new de novo formation of a distal anterior cerebral aneurysm, which is the cause of the hemorrhage. We then take the patient immediately for diagnostic angiography. You can see an AP view, the very distal anterior cerebral aneurysm. So under conscious sedation through a right femoral artery approach, we navigate a 6 French guide catheter into the right internal carotid artery. And on the roadmap and magnification, then we pass a microcatheter, a DMSO compatible microcatheter, all the way through the anterior cerebral artery into the branch that was originating the aneurysm from. Observe the microcatheter had to go all these tortuosities until we approximated to the aneurysm. Another angiography directly from the microcatheter demonstrates the aneurysm. It's feeding only from one very distal branch, and there is one single vein afterwards. There is some flow stasis already with the aneurysm. Similarly, in this AP view of the aneurysm, we then inject DMSO through the catheter in preparation for onyx. Prior to that, you can observe here how we like to approximate the microcatheter into the aneurysm if possible. This time we were able to do so. Once we have purged the catheter with DMSO, we then slowly inject onyx. In this case, we use onyx 18. Onyx is taking the shape of the aneurysm. Continue injecting it slowly. Make sure that we also take short segment of the perm vessel to make sure that the aneurysm doesn't recur. Post-embolization angiography demonstrates complete obliteration of the aneurysm, as you can observe there in a lateral view. And then similarly, we perform another angiography with less magnification and observe that the aneurysm is all gone with preservation of all intracerebral branches. Thank you.